Hello, my name is Ashlyn, and I'm a psych and mental health nurse practitioner, and I'm here today to educate you on your son's new diagnosis of schizophrenia. I understand that this can be a really hard time, lots of questions, lots of unknowns and whys, but I'm here to answer anything that I can for you and show you some support. Schizophrenia is a chronic and progressive psychiatric condition. It affects your son's ability to think, to feel, relate to others, how he behaves, how he interprets reality, making decisions. The cause of schizophrenia is unknown, but there are some genetic, psychological, and environmental links to this. We see schizophrenia a lot throughout families, so big genetic component there. Early infections in childhood, traumas, sexual, physical, emotional abuse, lots of stress. If the mother is exposed to certain toxins or viruses that hinder brain development during pregnancy, drug abuse, are all linked. In our brain, we have neurotransmitters, and these neurotransmitters, our body cannot function without them. They are basically little chemical messengers that send or tell our body like what to do, basically. They regulate our bodily functions. So in schizophrenia, it's seen that with dopamine, which is our reward center, our feel good, we feel pleasure, it regulates our mood. There is thought to be too much of this in the brain. Serotonin is another neurotransmitter that affects sleep, our mood, sexual desires, our digestion. GABA, which produces a calming effect. So it plays a role in fear, stress, anxiety. And then norepinephrine or noradrenaline, which you might have heard like the fight or flight response. So this has to do a lot with stress reaction, their attention, their state of arousal. These all are linked to schizophrenia. As far as like the structure of the brain, through studies and brain imaging, there has been seen a loss of brain tissue over time, especially the gray matter of the brain. But there are treatment options. There is no cure for schizophrenia. And what your son really needs is just a lot of encouragement and support. Suicide is very high among these patients, and it's key to just pay attention to any kind of suicidal thoughts, any kind of marks on their body, maybe from cutting or any kind of self-mutilation, and take your son to the ER if you see any of that. But we do treat this schizophrenia with antipsychotic medications. We have first and second generation. These medications, of course, do not cure, but they help with some of the positive symptoms that your son may experience, such as hallucinations, hearing or seeing things, delusions. If your son is just dead set that I am God, Dad, I am God, and there's no talking him out of that, it's a delusion. Disorganized speech. You're talking with him and he says, dishwasher, dog, rain, blue. Makes no sense. Almost kind of like a word salad. Disorganized behavior, wearing 5 coats and 2 hats when it's 90 degrees out. The negative symptoms is a decrease in emotions, loss of interest. He may not even talk to you, and be mute. Lack of motivation to do anything, inappropriate responses. The cognitive symptoms are things like trouble understanding or learning or memory. So the antipsychotics help with this in reducing these symptoms. It can help with the paranoia. A lot of times people with schizophrenia get really paranoid that people are out to get them, or a delusion that they're set on where they're going to be hurt. So these help with that. They do have some side effects that are not the best. So things like constipation, weight gain, the sedative effect. I've had people tell me, it makes me into a zombie. I don't like the way it makes me feel. So then this leads to patients not wanting to take the medications. Well, we do have options where patients can get long-acting injections. These injections typically every 2 to 4 weeks, and just depending on the medication. So that helps with being compliant. There are also antidepressants that can be prescribed that can help with the ups and downs of schizophrenia. The really elevated moods, like the manic, where they're just on top of the world, and then when they're just so low. These can help with that, along with mood stabilizers. And also, I can't stress enough, just the support and encouragement from you and the understanding can be very scary and very hard to admit that when you first start to hear or see things or any of this. It's just a lot to take in. It's a lot as a family, but there is hope. There's still research being done. We don't know a lot about it, but just giving him all the love and support and giving him what he needs. Your son has a future. Patients are still able to go to work, go to school, be an active member in society. It's all about just sticking to a treatment plan and preventing the reoccurring psychotic episodes. But if you have any questions, I'm always here to answer, give you any support that you need. I know it can be very overwhelming, and I know that your son is going to do great because he has a really good support system. And thank you so much for your time. Good luck.